Thank you, Malcolm. I'm always the one who's considered to be the pessimistic one, but at least Malcolm blunted it a little bit. So the title here is NIH Funder's Perspective, and I have to make a disclaimer right up front, and that is I do not speak on behalf of NIH, and opinions I will voice are not official opinions of NIH, and I have many opinions. Right? So the title of this whole session was actually about checklists and guidelines, and being a foreigner, I decided it's time to go to the dictionary and look up what they mean. So if you look at what a guideline means in the dictionary, it says a general rule, principle, or piece of advice. So thinking about it, it's more kind of long-term suggestions of what you should take into consideration. It's not about a specific task at hand. It's not like flying a plane, okay? And as such, I think it's worthwhile to look at the words of Benjamin Franklin, who said the people heard it and approved the doctrine and immediately practiced the contrary. In other words, guidelines aren't very good at getting people to change their ways. Right? So what about checklists? So the definition of a checklist is a list of items required, things to be done, or points to be considered, used as a reminder. Okay? It's for particular tasks at hand. And we've heard a lot about checklists. We just heard from Sonia and Malcolm about, checklists are doing good things. And these checklists are relatively, the ones that they were discussed, they're relatively new. So I decided to look at the literature of a checklist that was already discussed today, and that's the CONSORT guidelines, because it's been around for, more than 20 years. And specifically, at this publication in 2013, what they did is a very interesting systematic review. They compared publications in journals that endorsed the CONSORT checklist to those who did not. And what they found is the one item that had the greatest statistical significance between these two groups of journals was allocation concealment, which is very important for unconscious biases and things like that. And in non-endorsing journals, it was only 22% for the years that they looked at, and it went up to 45% in the journals that endorsed the guidelines. So a twofold increase, that's impressive, but it still means that 50% of half the papers, even though the journals endorse these guidelines, they don't follow it. They don't actually follow through and make sure that it'll be reported. And, this is kind of troubling, at least for me. And I wondered, why is this the case? So there could be many reasons, but I think the simplest one is you just have to look at the checklist. So this is the CONSORT checklist. You're not supposed to be reading the items here. It's just to get the general impression, a satellite view. And the allocation concealment is this one item out of 38 over here. When you have a long checklist, and people don't like to fill out checklists, you can end up with a situation where even really important items in the checklist get ignored, because allocation concealment is a very important one. So one kind of has to also take into consideration to prioritize the items and decide what to do best. So I'm going to tell you how my view of what can be done. So first of all, I hold the view that less can be more. And one should stage priorities. What do I mean by that? The CONSORT guidelines being around, or checklist has been around for more than 20 years, and still we're only at, let's say, 50%. Okay? So it's okay to think long term. Nothing's going to happen overnight. So what one needs to do is to say, okay, where do I want to be in 20 years? Not where I'm going to be next year. So I would suggest that one should have a very small set of items in a checklist, just like what happened with the pilot checklist. They had to pare it down to a minimum set of items that are the most crucial not to ignore. And once you prioritize them, you can have a small list and say, okay, let's get people trained over time and get used to using it. And once it becomes second habit, you can say, okay, now let me move to the next group of items and focus on those. So I think it has to be a long-term approach. We've heard already about the Landis et al. Paper and the recommendations there. I can take no credit for this. I thought it was an extremely interesting discussion at the end of the workshop where everyone said, okay, what can we do? What is the bare minimum that we are willing, Malcolm and Veronique here are smiling, what's the bare minimum that we can all agree has to be included? And all these items are items that are risk of bias items, okay? Items that if you think about it, if they aren't adhered to, all the rest doesn't matter at all, okay? Because if the data is not good, then no analysis, no reporting or anything will be of value. So that's where I got my inspiration from. Another thing that came out of the workshop that led to the Landis et al. Paper was an agreement that all stakeholders share responsibility. And we've heard that already today, talking about all stakeholders. And what I took away from that is asking the question, what can I do? Not what can the other stakeholders do, okay? What can I do to bring about a change? Because it's easy to say, this is not my responsibility, that's the other stakeholders' responsibility. The third thing is we've heard the entire first session today, every single speaker talked about the culture and that we have to change the culture, okay? So for that, we have to do is change the incentive structure. And how do we do that? That's not simple, okay? Really, there was no solution this morning. And one of the components of changing the culture is obviously education, but it's not the only one. But in dealing with the education, we decided to hold a workshop last year. We brought together people to discuss, what can be done. Some of the participants are in the audience. And heading into this workshop, we wanted to say, okay, do we really need that education? Maybe it's just fine, okay? So what we did is we then ran a survey of all the institutions that have a training grant funded by NINDS. Okay? And we found that we asked them basically, what are you doing to teach the principles of rigorous research? We found only 5 of the institutions had a course on the principles of rigorous research. And even this one course could not cover all the elements that are required, okay? To educate properly on the principles of rigorous research. So why is this the case? So I'll tell you my idea. My idea is that there's a huge energy barrier to building a program from scratch. You have to have the expertise, the motivation, the knowledge, and the funds to do that. And many of these are in short supply. Right? So we thought maybe if there was a free educational resource that would be comprehensive, modular, adaptable, and upgradable, that everyone can use for their own program, that would greatly reduce the energy barrier for creating a resource. And that's why we had this workshop. What was interesting are the recommendations from the workshop, at least the way I understood them. And I'm just going to give them briefly because it comes to the punchline. So first of all, we heard today that we should target the trainees. At this workshop, there was general agreement that one has to target the entire spectrum of research. The senior PIs some of them are no better than the graduate student, okay? Everyone has to be educated better on the principles of rigorous research. The other is that in order to have progress, okay, in order for any educational platform to have an impact, we have to change the culture of everyone, in academics, the publishing, the funding, and the organization level, okay? We then said that academic institutions need to play a proactive role in changing the culture. The institutions, if you notice, I mean, in most of the meetings I've been to, they've pretty much being missing in action. They're not invited, right, to these meetings. They're not part of the discussion. Right? And since tenure and promotion committees, hiring committees are all within institutions, they've got to play a central role. So looking at all this, the people invited to the workshop said something very interesting and important that and I think this is really my take-home message and the punchline. And that is, to achieve these goals, we need a grassroots effort. It can't come from the funders, it can't come from the journals, it can't come from the institutions themselves. It's got to be a grassroots effort. Everywhere, in every one of these groups of stakeholders, there are champions, people who believe that we've got to make a change. We've got to change the culture from glitter to rigor, to change the incentive structure. Okay? So what we need to do is somehow to create these communities of champions, to bring them together. And what we're proposing is that on the NINDS website, we have a place where champions can self-identify. And by self-identifying, saying, I want to be a champion, they can then identify others within their own institution that share their values, and they can start having internal conversations. And then somehow we'll have to find ways to support interactions between different communities of champions, bringing them together regionally, countrywide, and then globally. And I believe that through this grassroots effort, within 15 to 20 years, we'd be in a very different place as far as the culture goes. Thank you.
I think we'll spend a couple of minutes with...
Oh, sorry.
Oh, yeah.
Premature. You wanted me to talk about something and I forgot. Next slide. My apologies. Part of... can I change it? It's not moving. Okay, there we go. Part of, I think, what these communities of champions can do is increase transparency in scientific meetings. So NINDS funds numerous funds or supports numerous meetings, and I attend many, and I often get frustrated because I sit in talks or go up to posters, and I don't know how rigorously the research was done, if it's worth my time when I go back to the office to try to look up more work related to that. Now, you can't really blame them because 10 minutes talk or a single poster is not enough room to present everything, okay? So I guess someone can enlarge it, but it doesn't matter. So on the left is kind of how the typical way you might see a figure at a meeting. You really have no clue what's going on. You just see error bars, okay? And what we were proposing in this commentary is that we need to improve how figures are presented, and we can use that to increase transparency. So the idea is, well, first of all, by the way, these two figures are exactly the same figures, okay? I'm looking for the button for the, oops, not what I wanted to do, okay? Here. So this data is exactly the same data as here, just you can see the individual data points. You can see how many samples there were, okay? But importantly, what we proposed, a very provocative idea, that one could embed symbols or rigor emojis in the figures, which tell you instantly, you know, how things were done. So this means it was randomized, it was blinded, and it's a confirmatory study, okay? So this is an example of how communities of champions can help advance things, because this has not caught on yet. But one can imagine if locally this is being used and then shared with other communities, we can make progress. And now I'm really done.